complete recovery from COVID-19 we are now seeing can be a long process. These patients have been named COVID-19 long haulers.
The state says 82% of Pennsylvanians who've contracted COVID-19 have recovered, but that just means they're no longer contagious. Some have been dealing with the symptoms for months. And as you heard, a doctor told Channel 11's Joe Arena, these so-called long haulers are a mystery.
If you've suffered and then recovered from COVID-19, you may not be alone if you're still feeling its after effects. Tonight, we're learning more about COVID-19 long haulers and why their symptoms, on some level, still remain.
True recovery, complete recovery from COVID-19 we are now seeing can be a long process.
Pennsylvania Health Secretary Dr. Rachel Levine today speaking about how many people are still suffering long after they first came down with the virus.
These patients have been named COVID-19 long haulers, people who may be considered quote unquote recovered in that they had the virus at least several weeks ago, but they are still dealing with its lingering effects.
So why is this the case? We reached out to infectious disease Dr. Amesh Adalja at Johns Hopkins University to learn more about this condition. But right off the bat, we learned we're still kind of in the dark.
COVID long haulers are a mystery. We know that some people who get infected, have a mild illness, are then left with lingering symptoms.
The doctor says because this virus is so new to all of us, we're just beginning to learn about its potential. He also says that these chronic symptoms are much like those after suffering from other types of infectious diseases.
And it may have to do with genetics and the way their immune system responds to infectious organisms.
Right now, the doctor says thousands of people who've recovered from COVID-19 are reporting these lingering symptoms. But unfortunately, Dr. Adalja says there really isn't a trend in age groups or gender.
It doesn't completely discriminate. There have been some early data that people tend to be older when they have these long haul symptoms. They tend to have some comorbid conditions or other medical problems, but it's not everyone that has it. There are people who are perfectly healthy that develop it.
As for the timeline on when the medical community can determine the long-term severity and reasoning behind these symptoms,
this is something I think we're going to be dealing with for several months, trying to unravel these mysteries of these long haul symptoms.
In Pittsburgh, Joe Arena, Channel 11 News.